want to do. Here we are. We did a fair amount of this. I really want to talk about, we got through the mechanics of it, the anatomy of it, but now you have to really understand how it works. And really, again, to reiterate the point, it's about fight or flight. Going with all the names, we want to go Splanchniks and Rami. Don't have to. I'm getting here. I mean, there's so much. To me, I'm much more interested in you knowing how there's some basic anatomy. It's a two-nerve circuit. Parasympathetics, long pre, short post. Sympathetics, by and large, a short pre, long post. I made a comment about that. That's something you do need to be familiar with. The neurotransmitters, the fact that acetylcholine predominates, other than, with some very, very limited exceptions, the norepinephrine that comes out of the postganglionic nerve in the sympathetic division. But this is really where you're going to see this. And we talked about the difference. We have, there are important terms for many of you going forward, things like cholinergic, meaning it releases acetylcholine. The neuromuscular junction is a cholinergic nerve. The nerve going in there is a cholinergic because it releases acetylcholine. So understand that the receptors that we refer to as nicotinic receptors are both associated with the first nerve, that first synapse, which we call the ganglion, because they all cluster together. And the reason they're named as nicotinics is because they respond to nicotine. That was able to mimic the effects in the lab. And then, and that was for both the sympathetic and parasympathetic. The post-ganglionic nerves in the parasympathetic responded similarly to small bits of this extract of mushroom poison called muscarine, and they call them muscarinics. I mean, that's more definitional stuff, and for some of you, that'll be definitional stuff that you may very well have to know. But the other thing is what we're getting to now, and why I'm making such a fuss about this. If you're going into any clinical career, whether it's medicine or physician's assistant or anything along the line, you got to know this stuff. This is you're going to get hammered with this in pharmacology. It's very pharmacologically oriented. Terms we use all the time. And this is the thing, epinephrine, norepinephrine, we're getting here. I just wanted to really, underscore the importance, okay? Not doing the reflexes, but that's when they start, here you can see I'm talking about cholinergics versus an adrenergic. So the term is adrenergic, and rather than just having very strict, cholinergic is acetylcholine. The only little difference we define it was nicotine at one particular and muscarine at another. Here, these are big players. When we start talking about adrenergics, we have a lot more complexity than nicotinic and adrenergic. So here you can see the nicotinics are all postganglionic nerves of the sympathetic and parasympathetic, hormone producing the adrenal medulla, which is really nothing more than the sort of misplaced ganglion of the sympathetic nervous system. Neuromuscular junction 101, okay, open, and they're quick. When it opens an ion channel, it's a very rapid response system. I've tried to hammer that point a couple of times. That's why you're going to see it again. Muscarinic, all effector cells by postganglionic cholinergic fibers. And here there's a subtle difference. They're normally excitatory. The inhibitory one is famous. You must know it because it slows down your heart rate. Okay. Whereas, as you can see, it increases. So when we look at fight or flight, you're going to see all of those things very shortly. This is the point we stopped. Alphas and betas. You're going to hear all of these things. You're going to hear about alpha 1s and alpha 2s and beta 1s and beta 2s and beta 3s. If you're going into a field that deals with any of this, and I know it doesn't apply to everybody, but the majority of you are, and you'll hear about that. Well, like my son had high blood pressure issues, the one you didn't see in that particular, in the image, he just moved. He had high blood pressure issues. They put him on a beta blocker. Common treatment, beta blockers. They use those a lot. They've refined them. There used to be more problems with side effects. Now they're a little bit more specific. Okay? You know, believe me, you know some people who are on a beta stimulant for beta 2s. You all do. Anybody with an inhaler has asthma, if they're on Ventolin or one a similar inhaler, an albuterol inhaler, that's what you're basically losing something that's a beta 2 stimulant. It dilates your respiratory passageways. That's how this stuff works. So why it's important is there are categories of therapeutic agents. And so you'll see a lot of pharmacology. And indeed, other things we use all the time, we either want, as we get into fight or flight, we're either going to want to mimic the effects of the sympathetic nervous system or mimic the effects of the parasympathetic system. And you're going to hear terms like this: sympathomimetic drugs. They mimic the effects of the sympathetic. If you know anybody who's on Adderall for ADD or ADHD like symptoms, and we all know somebody who takes those psychostimulants, they are by definition sympathomimetic drugs. Okay. Other people use things that are parasympathomimetic drugs. They want to take it in the opposite direction. And then you'll hear terms like sympatholytic and parasympatholytic. So if it mimics it, you could have a sympathomimetic, but you could do it in the opposite way. If you want to make the sympathetic stronger because they're like this, you could block the parasympathetic. So you can have parasympatholytics and sympathomimetics doing the same thing. You're either making one work or you're stopping the other one from working. The effect is the same because they're homeostasis 101. I block one, the other one's stronger. Okay, I make one strong, and it weakens the other one. Got it? So there's a lot of classifications in your readings and future careers or people in your orbit. So it depends on the subclass of the receptor. So norepinephrine binding to cardiac muscle, beta 1. Not only does it increase the heart rate, it increases the force of contraction. The vagus nerve lowers the heart rate, that other receptor we just looked at, that oddball. It has nothing to do with it. It doesn't make the heart contract less. It's merely, you're going to see when we get into the cardiac unit, which is coming up right after this. Okay. Not the blood unit is coming up right after this. What you're going to see about that is that we look at it very closely. We have things called chronotropic and inotropic. Chronotropic, chrono, time. So it lowers the heart rate. And this norepinephrine increases the heart rate. So it's a positive chronotropic effect, but it also impacts force of contraction. It's a little more profound on the heart. Whereas epinephrine causes bronchial relaxation bound to beta 2 receptors. That's the idea of albuterol or Ventolin, which are basically the same thing. Beta 2 stimulant. Why? People use them for an inhaler. Because inflammation is involved. We use a lot of times they'll have that, and they'll have a steroid inhaler. Because that will reduce the inflammatory component. You all know somebody who has those. So you take a look. Nicotinics, okay, typically excitation. Muscarinic, nearly all excitation with the exception of cardiac muscle. Okay. This idea of the limited, you're going to see that acetylcholine is secreted at the sweat glands by the sympathetic nervous system. That's the oddball. So it makes you perspire to cool down the plant effectively. That's sort of an oddball that's associated here. So that's one of those other oddballs. There's only one area that I know of where the sympathetic nervous system doesn't release either norepinephrine or a combination of epinephrine and norepinephrine, and that is at sweat glands. And now look at all these adrenergics. Beta 1, heart, kidneys, and fat. Increases heart rate, force of contraction, stimulate the kidneys to release renin. We talked a little bit about we did not get to that yet. The blood is not next, endocrine is next. I'm putting the heart because I did endocrine with my A&P. So in endocrine, you will learn about renin. Renin is something that eventually increases your blood pressure. It's a potent catalyst to increasing your blood pressure. And fat tissue, to a certain extent, is just is enhancing energy supply. this is the sympathetic is a very active, that's the action division. So you're going to use fat, to supplement the available energy supply. Beta 2s, lungs, mostly sympathetic target organs, abundant on blood vessels serving the heart, liver, and skeletal muscle. So mostly inhibitory, dilating bronchioles, relaxing smooth muscles, digestive and urinary. And you're going to see why in a second. Here's the adipose tissue for lipolysis. And then you have alphas. These constrict certain blood vessels. Has impact on the eyes. And I'll get into all this. Inhibits norepinephrine release from adrenergic terminals. Inhibits insulin secretion. Which is all about. If you go over the sum and substance of these effects, you're direct and indirect. This is all about you. The best example, I've said it a couple times, is fight or flight. Fight or flight is what your body does in an emergency situation. It doesn't have to be an emergency. You don't have to be life-threatening or in danger or just escaping from an accident. Okay, it could be any number of numbers. If you're going to the gym and working out, you're going to go into mostly sympathetic activity. It's okay. What happens? Starts at the top. Think of this. Pure fight or flight is the closest thing to pure sympathetic. The opposite of that is pure parasympathetic. You just learn the one and you can mimic it all the time. Eyes wide open when there's danger. Your eyes are wide open. Your pupils dilate. The lens is flat. Okay? Your breathing is going to be able to increase intake and air take. It dries up your secretions. So salivary glands dry up. You can maximize going in and out. To that end, it increases respiration. To that end, it dilates the tiny bronchioles, not the big bronchi. There's no way you can open them. They're fixed. They don't get wider or narrower. But when you get down to the ones you're going to see with respiratory bronchioles, as the suffix tells you, what it does, it has rings, but it also has a lot of muscle. And that smooth muscle, when it constricts, doesn't let you breathe. But when it dilates, you breathe better. You need maximum air intake, bronchial dilation, because your respirations are going to increase dramatically. They're increasing to bring more oxygen because your heart rate's going up. So you need more blood flow to the cardiac muscle. So heart rate, force of contraction, lungs, degree of respirations, bronchial dilation, eyes wide open, secretions dried up, energy supply. You have to liberate stored energy supply from glycogen, the skeletal muscles, the liver's got to produce the body. It's getting very, very busy. And now, most importantly, we have to divert blood supply, okay? Dilates blood vessels and bronchioles, but those blood vessels are going specifically to the heart, and it's going specifically to, you can see, relaxes the smooth muscles, walls, and urinary. Blood vessels it's dilating are to the heart, and indeed the coronary arteries, to skeletal muscle. It's diverting massively your blood supply from those areas. It's going down to a trace because you don't utilize your digestive or urinary system. Down your urinary and digestive system, which gobble up at rest most of your blood supply by dilating those organs, not the blood vessels, but by dilating the smooth muscle. Basically, you put them at rest stage. You have enough blood supply so they're survived. They have enough to do whatever it needs to do to be viable. Okay, believe me, when you stop, they'll get busy once again. That's part of it. That's what happens. That's just, and all of these things are part. So with any of these systems, digestive, reproductive, that's not part of it. Fight or flight is active. You're churning out. You're overheating, so it's got to dilate. It's got to have an action to encourage perspiration. That's that odd thing. So it's going to cool the physical plant. There's going to be some blood, even though it's going to hold the blood in, it kind of takes the blood supply away from the skin, even though there's heat that's being generated, and that heat's being dissipated to some extent by the perspiration. That's just the way it works. That's pure sympathetic. That's fight or flight. And it only lasts for a limited amount of time that you're able to do that. I mean, barring like aerobic exercise. The other thing, and everything reverses when it's pure, because there's nothing that's pure parasympathetic. The parasympathetic is the opposite. You're doing, I'm sure you guys want tons of these. Ready, set, go, whatever they are. It's like unstoppable. It's one time. So, close work. Pupils constrict. Normal salivation, normal glandular activity. Breathing goes back to normal. Heart rate goes back to normal. We don't have to normal bronchial, not constriction certainly, but not excessively dilation. You just don't need to use the system, overuse it that much. Your heart rate goes down back to normal. The force of contraction goes down back to normal. The degree of the frequency of respiration back to normal. You redirected your blood supply to the appropriate areas. Some areas don't change. Your brain always gets the same. Okay, but now you've taken that. Let me tell you, rest somewhere approaching probably half the blood supply, and now you're bringing it back to where it's supposed to be. Your digestive here. So everything goes back to normal, and normally we're in a steady state. You know, we'll do something briefly for something that requires a little, we'll increase the activity, we'll temporarily divert this, as opposed to that X number of minutes, because you don't have a lot of energy for it. You have stored glycogen in your muscles. You already did the muscle. You have stored glycogen in your skeletal muscles and livers. That energy supply is limited. Yeah, they're going to break down some fats. After that, all of a sudden, your tank's running on empty. Physiologically, you eventually have, you know, and again, if we're doing an exercise issue, you go into exercise, you do exercise aerobically, you convert. You know, treadmill, you go, okay, I'll just go into a jog for a while, and basically do it. But then you go back, maybe you do a neutral. Very interesting sort of way that construct, so to speak, that's there. So if you look at all of these, they support that. All of these things inhibits norepinephrine release from adrenergic terminals. So we're at the point where we're trying to limit it, and most importantly, insulin. Insulin is best to digest. We if anything, insulin is a system that is designed to bring it in from the bloodstream after you've had a meal, not when you're doing emergency physical activity. And there's a couple of 3 minutes, and what happens when fight or flight stops, and I always use the analogy like the crash cart in the hospital. The first thing you learn in a hospital, what do we got to do? As soon as the emergency's over, somebody who's in charge is going to turn to somebody else and say, get the crash cart ready. Yep. If you've ever seen a hospital after an emergency room after a code, everything is everywhere. And you never know when the next one's coming in. That's your body. It has to immediately replenishes the glycogen in your liver, and your skeletal muscle, replenishes the oxygen debt. All of those things get reversed because the next emergency could be right now. Just the way it works. So I can't tell you how many times you heard it. Who's ever calling that code, or whoever is the nurse in charge in that and the reason I know is my ex was a head nurse in the emergency room in the hospital we worked at. You know, they say, hey, go get the cart, see what happens. Because you got stuff all the ampules of this, ampules of that. There's only two things that happen after a code. Patient lives, patient dies. There's no middle ground. So hopefully you're sending them up to the ICU. That's the goal of the exercise, not the other. So as we look, you can see these. You can see this is what they do. Now look at the agents. They're there. Nicotine. We use it all the time. Smoking cessation products. How many people do you know walk around with a patch like that? Okay. Same thing. If you know somebody's wanting to stop and they decide to vape instead because you don't have theoretically as many problems, don't get me started on that. But at least it's worthwhile. Sir.
So I heard that some people who have schizophrenia that aren't on medication sometimes self-medicate by smoking because of nicotine. Do you know how that works?
No, I do not. Oh, okay. I've even seen people who feel that, trying to think, I don't know if they're less likely to be, they're less likely to get COVID. I've heard that. I don't know if that's, one of those, here's, home remedy. It could be. I don't know enough about it. And I used them ineffectively for stopping smoking. They didn't work for me. But I've seen people who do certain things, but the reason they come in patch form is not active oral. It gets destroyed by your stomach acid. So you have to use, so that way vaping it, you can use gum. The gum isn't oral, it's absorbed in your mouth. Okay, or the patches. Patches, using transdermal patches is a very, very effective way. Very easy way to regulate medication that comes in as long as it's fat soluble, because you know the rate based on the concentration. So we know exactly how much nicotine, for example, you're going to give over a X period of time, 8 hours, 12 hours, 24-hour period. Nothing new under the sun there. So that's classic nicotinic agent. Parasympathomimetic, remember? So it mimics the parasympathetic. They call them muscarinic agents. So years ago, they were using, and I do not know if that is still being used for glaucoma, but its effect were to open up that drainage area. And this botanical, there are better, this used to be a problem. And I know it because I was on something like that initially when I had the bladder cancer and prostate related problems because of the treatment. This stuff is weird. Okay, they now have, oh, it's because I was on it. It'll come to me. There's an agent that's very useful that if you know anybody with prostate disease, any man with prostate disease, they're probably taking it. Tamsulosin, and I'm trying to remember the name. The generic name is Tams. Oh, I hate to do it, but that's where they made a phone. If I was fast, but my spelling is horrible. Tamsulosin hydrochloride, also known as, help me, Flomax. It to maximize urinary flow and much better tolerate the other stuff. I remember when I was using that, yeah, I mean, it's almost like you're feeling shaky because what it's doing is mimicking too many of those effects. The other one was very targeted specifically to bladder musculature and the area around the prostate pretty well. These, okay, nerve gas. Remember we talked about acetylcholinesterase inhibitors? This is the one for myasthenia gravis. So we had covered that earlier. So, I mean, they're well known. But here's the term, sympathomimetics. Here's the Ventolin or albuterol for asthma. And also, and now phenyl, we've gone to phenylephrine. So years ago, they used pseudoephedrine. Ephedrine, a little pharmacological history for you folks. Okay, amphetamines were developed in the 30s as a wonder drug. They found an ingredient called ephedra in certain types of Chinese teas, Oriental teas, particularly Chinese teas, my recollection of it. And they synthesized from the ephedra something called ephedrine, which was the parent, which later in the laboratory they converted to the first amphetamines called benzodrine. The ephedrine was very useful because it dilated respiratory pathways so people could breathe better. That was one of the use. But they found out not only did it make them more awake and alert, but it was an appetite suppression. And that was available without prescription, by the way, for the longest time. And so it got a lot of utilization during World War II. I mean, and frankly, it was utilized a lot still in the armed services when they were flying multiple sorties. I mean, those pilots were come in, boom, next plane. Yeah, they weren't taking breaks after so many hours. I mean, they were fighting, to stay alive. World War II was desperate. So they started to use, they were on benzodrines, they were taking bennies for this. They were around for a long time. Early days, people with allergies and asthma would have an inhaler. It was like a paper called a Benzodrex inhaler. It was speed. It was like a paper that was impregnated with benzodrine in a little plastic container, and just like you and I, if you have like those cortisone sprays that you can get now, kind of all of that, but it wasn't a spray. You just took it out and all of a sudden, hey, you're buzzing. But what it does is it shrunk the membrane. As a stimulant, it would shrink. Remember I said it dries up secretions. So it would shrink the membranes. The problem was with Sudafed, this is the whole idea of the show Breaking Bad, was that Sudafed, with anybody, you could buy it in bulk. You just go to the pharmacy, get a bunch of packages, and they started to restrict it. And it was in a lot of cold preps, like NyQuil, stuff like that. And so if you know a little bit about chemistry, I mean, you can do it at home with some danger. But I mean, all that stuff is, somebody knows how to cook it at home. And, yeah. The statute of limitations is, and I don't even know where these guys are anymore, but there were chemicals in the chem lab when I was in college that was a bigger reaction to make amphetamines. Called phenylethyl ketone, that and hydrochloric acid, you dried it off and powder left behind with the salt, left behind, was guess what? Okay, speed. They manufacture pure. Now they did away, obviously, with those things. Effectively, that's the combination of chemicals for an organic product. We say BLTC. They're living through chemistry. Thankfully, I was not inclined to do illegal stuff like that. I did want to have a life outside of jail. Nevertheless, and so we switched over time. They have switched to phenylephrine because you can't. It's similar, but you can't. It doesn't have the capacity to be made into an illicit substance that could be extraordinarily harmful and dangerous. And this was one of the early beta blockers. They don't use it anymore because it had a lot of side effects. That was propanol. Fascinating. So you should know some examples of those going forward. As we continue, most organs have dual innervation. That's the beauty of the system. That's homeostasis. So what happens is, and I love the term dynamic antagonism. It's so precise. So for those moments I get up and do things here to try to demonstrate or get excited about doing something, my heart rate's going up, my respiration changes, my blood pressure's being altered. And when I sit back down, it changes. And I say it all the time. If you check your temperature, if you check your blood sugar, all of those are snapshots. Any one time. The way is to take all the data, save it, and effectively, and now it's done fairly easily by devices, and graph that stuff out, and you can see what sort of the pattern. When am I using it? What events are like that? It's really how you study that thing, and that's how, at least in diabetology, we would take a look at, with the advent of glucometers and recording glucometers, you would be able to take that probably a little chip and program it or send it directly and be able to view it graphically. I mean, the technology. I mean, I stopped practice before all of a sudden we had computers and everything was digital and things like that. I got my first computer, but it was for billing purposes in 1985. So we were starting to put people on computer. My original modem, I mean, you know how fast the phone works. I had a dial. Are you ready? 14.4 kilobytes per second. It was one of those dial-up things. I had it here. My phone dialed it up, put it into that little cradle, listened for the tone. Like beep. That connected me with my office in a neighboring town. Their phone. That's how we moved data around. We had a smart terminal in my main office, what they called a dumb terminal, because it wasn't a computer. How's that? Just saying. I had a IBM, what was called XT. You had the original PC, then you had what was called XT, and then the one that really changed it was AT. That was an 8286, 8386 system. So voila. So they all have their own tone. They're all, with the exception of fight or flight, they're always somewhat active and they cooperate. So very precise control, sympathetic, increasing heart and respiratory rates, inhibiting digestion and elimination. Parasympathetic, the opposite. The most important thing to note, effectively, all blood vessels, smooth muscle is entirely sympathetic. So that is blood pressure. And because of that, that's kidney. That's the unique thing. But the kidney does not have dual innervation. It's all about the blood vessels. And I'm trying to think off the top of my head what would not be a blood vessel smooth vessel that would be controlled by that. Maybe there is some smooth, maybe in the brain. I'm just thinking off the top of my head. So the sympathetic tone, very famous, vasomotor. Motor means muscle, vaso for vessel. So we're talking about the smooth muscles in blood vessels. They're always partially constricted. And that is the most famous number of them all. That's the lower number of your blood pressure, the diastolic. That is a measure of sympathetic motor tone. It is extraordinarily important. That's the one we worry about. Take all the blood pressures, and again, it's a snapshot. What is the typical lower number? That's what, because think of it this way. That's the resting pressure. Your heart has to work against it. There's enough pliability, particularly when you're younger, to expand it at systolic, to open it when the pulse occurs. How much force does it have to overcome at a minimum? That's the resting tension. That's the bottom number. That's what it's like at rest. Big number. When that gets for young people like you, if yours is over 90 now, you have to do something about it right away. Then you have some problem inherently with high blood pressure. It's a little more forgiving. As you get older, you can forgive it a little bit more, not because you should, but because the vessels themselves lose a certain amount of elasticity. They become more rigid. So it's unusual to some extent not to find people who have had at least take some kind of blood pressure medicine, or at least have to be cognizant of diet or salt intake. There's a lot of controversy about that. I think because I lost weight and I'm more physically active, I could probably do away with one, if not both of my. I've been on get rid of the medicine. Let's see, blood pressure drops, sympathetic fibers fire, and it's it. It's that's your tone. The pressure starts to go. The sympathetic fibers fire faster. They bring it back to normal, and the opposite is true. So, and this is perhaps as important as any, is that what you were looking at before? Its ability to shunt the blood. I mean, all areas need blood supply, and some have to maintain it constantly. If you stand on your head, you're going to get the same amount of blood supply as if you're sitting normally. It doesn't change. It's all that rate stays relatively constant. Yeah, you tell me it'll be a little bit more if I'm standing on my head, but who does that? The Cheshire Cat can do that.
You saying all the blood will...
Right. Because it'll constrict. I mean, short term. I mean, we're not talking if somebody was hung upside down. That's a different story entirely. That's how Gomez Adams in the original Addams Family TV show in the 60s would relax. He'd stand on his head. Or the Cheshire Cat, who literally would his head stand. Alice in Wonderland, Sterling Holloway. He was the voice of the Cheshire Cat.
Weird to smile.
Yeah, sure. Love Alice in Wonderland. Okay. Nice looking young woman. 35 years ago, I was more than happy to watch continually Alice in Wonderland and all those wonderful Walt Disney films. Yeah, we watched it twice already. I want to watch it again. Shut up. I was that there. Parasympathetic normally dominates, really, because more time we're less active than more active. Heart, smooth muscles, digestive, urinary tract, activates most glands except adrenal glands, and particularly we're talking about the adrenal medulla, okay, and sweat glands, okay, and that's parasympathetic tone. So sympathetic has that remarkable ability to override it, okay, as well as drugs that block the parasympathetic. They can increase heart rate. This is the problem with some of them, because now because they're impeding digestive and urinary activity, there's issues with it. So there's always been some difficulty with that, particularly people those parasympatholytics were problematic, to say the best. This is absolutely the best example, classic. The two divisions is external genitalia. So if you think of sexual physiology, not reproductive, more sexual. Parasympathetics are the ones that they lead because of vasodilating. We're not talking about skeletal muscle or cardiac muscle. They're going to vasodilate the other structures, particularly as part of the arousal process. That's parasympathetic. The climax or ejaculation, that is sympathetic. So whether it's what we call climax or the reflex contraction vaginally or the ejaculation of semen in males, is sympathetic. That's it's in that great movie with Eddie Redmayne about Stephen Hawking, and he's having children. Here he is in a wheelchair, and he throws amyotrophic lateral sclerosis. And he had a great line. How can you have another kid? You're in a wheelchair. He goes, different nervous system. Well, his autonomic nervous, it's a different nervous system. He was still functional in that regard. Makes sense, doesn't it?
That's how he was able to cheat on his wife.
Hey, I'm not judging him. There'd be a long list of people who have cheated on their significant others if we did. There's a very long list. So all of these things, unique roles, sweat glands, hair standing on end when you get excited, whatever you want to call it, goosebumps, goose flesh, everybody has a different term. Okay, all the blood vessels only when the body temperature rise, sympathetic nerves dilate. They tend to hold blood into the central core, but when the temperature starts to go up, then they have to dilate to allow blood flow to the skin and activate the sweat glands to relieve some of the temperature, and the opposite obviously is true. The kidneys, again, we're going to talk about the renin-angiotensin mechanism next chapter. Increasing metabolic rates, blood glucose for energy supplies. And the thing is, it's because you're not using insulin, it's more in line with things like, you'll see with the human growth hormone, we tend to utilize fats for a fuel. So a lot of it, because you're working out, you ever look when you're on the treadmill and you can time it so you can have a cardiac, and then you get that fat burn that you can, after about 30 minutes, it's cardio. And after any time after that, you're looking at fat burn. A lot of people, they want to lose weight, they focus on it. They want to get into that level. And so parasympathetic, short-lived, very localized, because acetylcholine destroyed quickly. Sympathetic, longer. That's that long-term effect you and I get from fight or flight. That idiot cuts you off, and you're like, try to catch your breath. Your heart's your heart's pumping. You're respirating. You come in looking just like we had a couple of girls who almost got run over coming up through the parking lot in my 12 noon class. You're so and so just you're driving too fast. But you'll come and you'll be able to tell when somebody looks flush, irregular, prolonged effects, because it's not as the epinephrine, norepinephrine not deactivated. Yes, sir.
You train it.
But
Flex like that. Is whenever we did the motorcycle class, they had you gradually step on the brakes. But whenever someone cuts me off, I'm not gonna. My back tire just skids the whole time. I can't unlock it. I feel like I get stuck.
I don't know. I mean, sure, I wish I had an answer for you.
That's why they invented ABS, I'm guessing.
It's very hard. When you're hit, and that's what would happen. Before anti-lock brakes, I mean, you were worried to death. If you hit it, you would skid.
Skid, yeah, that's what.
And so the anti-lock would just do what you were taught to do. But who thinks about when somebody cuts you off and you're having a near-death experience? Well, I better pump them. I mean, around here, we're a little better because of the ice. And we're a little bit more used to that.
Right.
We don't just jam on the brakes. So instinctively, oh my God, stop, rather than pumping, which you should. So maybe, I don't know if you can mentally train. I don't know if you can physiologically train it. And go ahead. Sorry.
They tried to in the course. They tried to teach you how to. I don't. Like I said, it's different whenever you're out. 76 or 70.
I'll bet. I'd be, you see the appropriate term, chicken to do that, to ride a motorcycle. My middle son has built one. And I took one modified aftermarket and sold it for a bunch because he likes to do that. He rides around. Not me. Chicken. Okay, autonomic neuropathy. In endocrine, we'll try. This is part of diabetes. Extraordinarily common. And what happens is, it's probably due to toxic byproducts affecting small blood vessels and even the nerves. The blood vessels supply the nerves of the nerves themselves. This is a very classic sign, particularly in diabetic men. They get early sexual dysfunction, okay, and other things, dizziness. That's part of what happens with blood pressure problems. Like me with blood pressure medication, you can't just jump up and I can do that now, but first thing in the morning, I get out of bed, I stop. You see anybody older, you get what's called orthostatic hypotension. Those wonderful little sensors aren't quite as sensitive. They're a little better as you go through the rest of the day. But if you're in bed for whatever X number of hours, not easy. So I'm always there. I've always got something to hold on to. I remember telling my mom with a walker, edge of the bed. Then when you finally get to the walker and stand up, you wait. Take a few steps to the walker, you wait. Even if it takes a long time to get from point to. My mom was pretty good at doing it by herself till about age 90. My mom to be 93. So these are different things. They're little tells. This is a big one for men. Okay, early on, 30s, 40s with diabetes that's typically not being taken care of. Incontinence, sluggish reactions, sweating problems, and it's all about, I'll get into it with diabetes. Remind me, I'll give you the anecdote about that. Limbic system, it's just an emotional center will often trigger it or prolong it. Let's stop here because I'm buzzing through that. I'll see if there's anything left and we'll catch it on Friday. So I'll get busy trying to get that review thing because we already covered that material. Thanks a lot. Maybe I'll have more pictures. What a